A physical exam is a lot like detective work. Seriously, the body holds all the clues, and it's the doctor's job to piece them all together. In this explainer, we're going to follow the trail of one of the body's master controllers, the thyroid gland. It's a small gland for sure, but it has a massive impact on our health.
So, let's kick things off with a really intriguing question that gets right to the heart of this detective story. How in the world can a doctor spot a thyroid problem just by looking at your hands? Stick around because we are absolutely going to solve that mystery.
Okay, but before we start dusting for prints and looking for clues, we need to understand our subject. What exactly is the thyroid, and why is it so important?
Think of your thyroid gland as the thermostat for your entire body, or maybe like the main control for your body's engine. It's sitting right there in your neck, and its whole job is to set the pace for your metabolism. Is your engine running way too fast and hot, or is it sluggish and cold? Well, the answer to that question often starts right here. The investigation begins the moment the doctor sees the patient. Seriously, the very first clues are gathered just from a general observation, a quick but really careful glance from across the room.
And you can see right here how much the thyroid setting affects, everything. If it's overactive, that's hyperthyroidism, the body's engine is just running way too fast. It's burning through energy, which can lead to an anxious appearance and a thinner frame. But if it's underactive, hypothyroidism, that engine is sluggish. The clues are the complete opposite. A calmer, sometimes puffy look, hair loss, and get this, especially on the outer third of the eyebrows, and dry skin. It's like two sides of the very same coin.
So after that first general look, the detective work starts to zoom in. And the eyes, in particular, can be incredibly revealing. They really do tell a story.
Now these eye signs, they're huge clues for an overactive thyroid, especially in an autoimmune condition called Graves' disease. You might see what's called lid retraction, which creates that constant wide-eyed staring look. Or you might see exophthalmos, that's the classic bulging of the eyeballs. A doctor can also check for ophthalmoplegia, where the eye muscles are affected, just by having you follow their finger. Each one of these is a critical clue. All right, after gathering all those clues from a distance, it's time to get hands-on. This is where the really subtle evidence starts to come to light. And here we are, back to our initial question. The hands, it turns out, are a total goldmine of information, a place where the thyroid's influence becomes physically tangible. Okay, so here it is, the answer to our mystery. An overactive thyroid makes the body's engine run hot, which leads to warm, sweaty, and sometimes even red palms. You can also get a fine tremor and even some changes in your fingernails. But on the flip side, an underactive thyroid means a cold engine. That results in cold, dry, thick skin. It can even be linked to carpal tunnel syndrome. Pretty amazing, right? You know that fine tremor with hyperthyroidism can be so subtle that it's easy to miss. So doctors have this brilliant little trick. They'll have you hold your hands out and place a piece of paper on top. That tiny tremor gets amplified and makes the paper shake. It's a super low-tech but incredibly effective diagnostic tool. And while the doctor is right there examining the hands, they're also going to check the pulse at the wrist. And again, we see those two opposing stories. Hyperthyroidism revs up the heart, causing a rapid, racing pulse called tachycardia. Sometimes it can even get irregular. Hypothyroidism, on the other hand, slows everything down, resulting in a slow pulse or bradycardia.
But the clues don't stop there. The investigation moves down to the lower limbs. With Graves' disease, you can get this specific lumpy-looking rash on the shins. An underactive thyroid, though, can cause a pretty unique type of leg swelling that doesn't leave a dent when you press on it. And even the reflexes follow the pattern. They're hyperactive when the engine's running fast and sluggish when it's slow.
Okay, we've collected all the peripheral evidence from head to toe. Now it's time for the lead detective to go straight to the source of all these clues, the thyroid gland itself. The neck exam starts with just simple inspection. Is there any obvious swelling? What's known as a goiter? Is there a scar from a past surgery? The doctor will have the patient swallow a sip of water because the thyroid gland moves up and down when you swallow, which helps them confirm what they're looking at. They'll even ask the patient to stick out their tongue, which helps rule out a different kind of neck cyst.
Next comes palpation, which is just a fancy word for feeling the gland. And the best way to do this is actually from behind the patient. With their fingers gently on the neck, the doctor asks the patient to swallow again. As that gland moves, they can feel its size, its texture. Is it smooth and large, or are there distinct lumps? And they check if it's tender to the touch.
The final step in the neck exam is listening with a stethoscope. Because in some cases of hyperthyroidism, specifically Graves' disease, the blood flow through the gland is so intense you can actually hear it. It's this whooshing sound, almost like a vibration. It's called a thyroid bruit, and hearing that is a very, very strong clue. So all the clues have been gathered. The anxious look, the sweaty palms, the racing pulse, those eye signs, and that whooshing sound in the neck. Now it's time for the doctor to put it all together and solve the case.
So, what's the solution to the mystery? Well, here's the crucial point. For both conditions, the most common culprit is an autoimmune disorder. That means the body's own immune system is mistakenly attacking the thyroid, either telling it to work overtime, like in Graves' disease, or telling it to shut down, like in Hashimoto's.
This table lays out the primary suspects perfectly. For hyperthyroidism, it's usually Graves' disease, and that's the one that's unique because of the specific eye, skin, and nail signs we talked about. For hypothyroidism, it's most often Hashimoto's. Now, of course, there are other causes, like nodules that make too much hormone or damage to the gland from surgery or radiation. And because the primary causes are autoimmune, the detective work doesn't stop there. A good doctor will also look for clues of other related autoimmune conditions. Things like vitiligo, which causes patches of skin to lose their pigment, or signs of rheumatoid arthritis. Finding these just strengthens the diagnosis and helps build a more complete picture of the patient's health. And that's really the power of this whole process. The physical exam isn't just a series of random checks. It's a systematic investigation that pulls together dozens of small clues into one coherent story. It creates a roadmap that points directly toward a likely diagnosis and guides the next steps, like what blood tests to order and how to start treatment. It's a powerful reminder that our bodies are constantly communicating, telling a story through countless small clues. The key is just learning how to listen. So the question we'll leave you with is, what story is your body telling you? Thanks for joining our investigation.